My name is Owen McPeake, and I'm starting my acupuncture and Chinese herbal medicine practice in Berks County, Pennsylvania. I first learned about acupuncture while I was growing up in the area from people who were working hard with their bodies. People need medicine that restores functionality without inhibiting ability. Traditional medicine initially struck me as fringe, but I learned it's practical. Acupuncture is the perfect therapy because it's non-pharmacological. The needles are much smaller than the Western kinds that intimidate many of us. They're actually about the size of cat whiskers. Acupuncture doesn't have side effects. There's nothing in the needles, they're solid. Using them simultaneously encourages and directs the body's ability to heal itself. Chinese herbal medicine uses multiple plants administered in combination as a formula. We call it herbal medicine, but it's really all about the formulas. Herbs are never administered alone. Chinese herbal medicine is unique amongst all forms of herbal therapy for the way it organizes herbs together. By pairing herbs together systematically, Chinese doctors learn to naturally strengthen the intended effects of the formula. Formulas are classically described as songs. They should be balanced, concise, and fit the disharmony of the patient. There are over 350 commonly used herbal drugs and as many herb formulas, which treat conditions ranging from the chronic inflammatory to the common cold. In my practice, I exclusively use classical herbal formulas. Many of these have been in use for literally thousands of years. It's my job to tailor them to suit my patients. I decided to learn Chinese herbal medicine and acupuncture because I want to serve people right here in eastern Pennsylvania. People don't have enough choices for effective care, which falls outside the medical environment. I practice to de-escalate symptoms and to encourage people to be free from dependency on anything but their good habits. When asked the common question, does acupuncture work for X, Y, or Z, my answer is probably. There are no traditional therapies that have such a long history or broad scope of practice. Acupuncture and Chinese herbs was the way illness was treated in China. This medicine is so rugged that it's been used and developed for over 3,000 years, right up to the present day. The Chinese know that and incorporate both practices into mainstream medicine. It's not an alternative medicine there, it's widely used. But in the United States, it's up to us. I wish to realize this vision of a practice in rural Pennsylvania in my home of Berks County. To do so, I require a small startup investment of $5,500. Your contribution to my crowdsourcing target will allow me to start an herbal pharmacy with a complement of about 200 herbs, with which I will compose formulas, along with an industrial herb grinder, acupuncture needles, treatment tables, and a few other items to make this practice possible. This summer cottage is where I will practice Chinese medicine and have my herbal pharmacy if this campaign is successful. Your contribution will be rewarded with an acupuncture consultation and treatment, or a package of treatments and herbs to be used whenever you may need them. I'm leveraging the crowdsourcing model to raise this capital for a number of reasons. My primary aspiration is to share this realm of medicine with a population that I believe could truly benefit from it. Many in our community work with their bodies, live active lifestyles, and want to spend time outdoors doing the things that make them happy. Whenever possible, their preference is to resist the pharmacological dependencies, invasive procedures, and high costs of conventional therapies. What acupuncture and Chinese herbs offer is a potentially comprehensive form of medicine free from side effects that can be used as a form of practical and natural primary care.